This is a presentation on benzodiazepines by Noah Hamlin, Denise Hazen, Sarah Merritt, and Matt Yelvington. Benzodiazepines, or benzos, are a medication class frequently prescribed to treat anxiety, panic attacks, and sleep disorders, as well as post-traumatic stress disorder, bipolar, and sometimes even schizophrenia. These medications include names that you've heard like Xanax, Valium, or Clonopine, among others, and they have risen in use in polypharmacy with opiates to treat chronic pain. The abuse of benzodiazepines often includes combining them with other drugs to increase effects, including methadone and heroin, which leads to increased depression and anxiety, as well as other psychopathology. Most patients take benzos as prescribed, but since their introduction in 1960, misuse and abuse of benzos continues to grow. There were an estimated 186,000 benzo abusers in 2010, and emergency departments have seen an increase of 139% in visits related to benzos. Risk of benzo misuse and abuse is related to comorbid psychiatric disorders as well as personal or family history of substance use disorders. Benzos are most often taken orally, but they can be abused when too much is taken or when they're combined with other substances such as alcohol or opioids. Crushing and snorting is another way that benzos are abused, as well as crushing and absorbing them under the tongue. They are not often injected because they're not water soluble. So if they're injected, that can lead to the amputation of a limb. These administrations allow the effects to occur more quickly and potently, but the length of the effect is similar to oral administration. Benzo abuse and misuse can be put into two different categories: intentional misuse for the intention of getting high, and unintentional dependence on a legitimately prescribed medication, later leading to inappropriate use. Most often, benzo abuse is in conjunction with opioids and alcohol, and those who abuse benzos with other substances use higher doses of benzos than those who only abuse the benzos. The abuse of opioids is highlighted in present-day media and government, but opioids and benzos are the top two most common prescription drugs related to overdose deaths. Alcohol combined with benzos is dangerous as it requires less benzo levels to cause death due to the impact on the central nervous system. Individuals report that their source of benzos was through their healthcare provider, a script doctor, using multiple doctors, or pharmacy theft. Some neurological effects include calming nerves, increasing focus, as well as motor control and vision. Benzos bind to the gamma-aminobutyric acid receptors, or the GABA receptors, and those receptors are responsible for calming down, increasing that focus, having motor control, and vision. Low levels of GABA can lead to anxiety. When benzos are absorbed and metabolized, the GABA receptors are enhanced, but chronic exposure leads to symptoms of tolerance and then withdrawal. In a study of methadone maintenance patients, women who abused benzos during pregnancy had babies with lower birth weight, and patients using benzos had a much higher risk of death compared to methadone patients not using benzos. Long-term use has been shown to cause impairment to coordination and attention, visual spatial ability, mental processing and confusion, and the ability to learn new information. Long-term use also leads to an increased risk of respiratory failure, cancer, and even Alzheimer's disease, as well as other psychological side effects like decreased cognitive functioning, increased depression, sleep disorders, and impulsivity, leading to a higher suicidal risk. There are many common side effects of benzos, including drowsiness, fatigue, impaired motor coordination, and abrupt discontinuation of the medication can lead to seizures. Withdrawal effects from benzos can persist for weeks, and anxiety symptoms will be increased as new GABA receptors are being regenerated.
It is helpful for family members to be educated on dual diagnoses associated with benzodiazepine use, so adequate support may be provided. According to the American Psychiatric Association, diagnoses associated with the use of sedatives, hypnotics, or anxiolytics include psychotic disorder, bipolar disorders, depressive disorders, anxiety disorders, sleep disorders, sexual dysfunctions, delirium, neurocognitive disorders, substance use disorders, substance intoxication, and substance withdrawal. Dual diagnosis is either associated with symptoms that lead to the prescription of benzos, such as anxiety, or the diagnosis is an effect of the abuse of the drug, such as insomnia, headaches, and anxiety. Cato and colleagues discussed the increased risk of suicide associated with the use of benzos. Because there is research that indicates suicide risk may be higher due to use and abuse of benzos, close attention should be paid to depressive, psychotic, and bipolar disorders, and the possibility of dual diagnosis with the overuse of benzodiazepines. It is evident that the misuse of non-prescription and legally prescribed drugs causes many negative consequences. 76,000 to 137,000 Americans die, and an additional 1.6 million to 2.6 million are injured due to bad reactions from legally prescribed drugs and over-the-counter medications each year. There are many ways in which society can respond to and support individuals experiencing prescription drug abuse. Providing more extensive and thorough education to physicians about benzos, the abuse of them, and how to minimize use may be helpful. Benzo abuse may also be reduced by increasing the role of the pharmacist, who is the key to identifying drug interactions, inappropriate prescribing, and patients to fill multiple prescriptions. Communication between pharmacies and physicians needs to be increased. Other ideas include requiring multiple prescriptions for scheduled drugs, minimizing the advertisements of drugs, encouraging patients to protect their prescription drugs and safely dispose of unused and expired drugs, and integrate computer tracking of prescriptions for highly abused medications. Research discusses how a better understanding of benzo withdrawal symptoms and pharmacological dependence are needed to better inform the public and decrease substance abuse. Researchers agree that the misuse of benzos is a growing public health concern that has not received enough attention. Recommendations are made for subgroups who could benefit from treatment and prevention methods, treatment targets, and points for intervention.
All right, so I'm going to talk about some initial treatment considerations that we have for benzodiazepine addiction, or I'll call them BZDs. Initially, the highest population of BZD misuse is among 20 to 29-year-olds. This demographic typically uses them as a club drug, often mixed with other drugs, as was talked about before, alcohol, heroin, cocaine, to counterbalance the effects of those other drugs. But again, this poly-drug use can be dangerous, leading to overdose. Benzodiazepine addiction ranges across age groups, even though the most frequent age group is the 20 to 29 age group. The elder population is a growing age group that has addictions with BZDs. This group is hesitant to seek treatment because of the stigma already that they're a little, or that they might be helpless, or they might be dependent on other things. So being addicted to drugs would indicate more helplessness or more dependence. So they're maybe less likely to seek treatment. Some other cultural factors that might come into play are the drug culture, the drug subculture in and of itself, which often, when studied, feels stigmatized. And if they're a cultural minority, such as African American, LGBTQ, and also in the drug culture, they feel even more stigmatized and maybe less likely to seek treatment. And it's also important to recognize, as the therapist, what the motivations for the abuse of BZDs was. Women typically abuse BZDs twice as much as men. About 20 to 50% of women above 60 became addicted or dependent on BZDs when they were prescribed them. And if it's used over 4 weeks regularly, about 35% of users became dependent on BZDs. So the ideal treatment frame for BZDs is between 2 to 4 weeks and then cessation or a slow taper. It's important, again, to remember treatment will differ between the populations for what they're using it for, why they became addicted, what access do they have to medical doctors or the pills. But they did find similarities among all people who abused benzodiazepines, and those were higher levels of neuroticism, an introverted personality, maladaptive coping strategies, and they had previous adverse life events, along with current unstable social environment and unstable psychiatric conditions. As was mentioned earlier, like anxiety is probably the most frequent one that BZDs are prescribed for. So when doing therapy, it'll also be helpful, as I'll talk about in a little bit, to also help treat the general anxiety or social anxiety or whatever may be the presenting cause that led to the BZD addiction. It's important to remember an initial treatment for BZDs. A tapered detoxification is crucial because abrupt cessation of benzos can have very serious side effects and potentially be fatal. The most effective taper has been shown to be a 10-week taper, and this has led to evidence of a maintained long-term sobriety. Inpatient treatment is typically helpful for this initial taper or this initial detoxification. So a full on-staff doctors, nurses, and psychiatrists can be monitoring the individual as they withdraw and may experience some severe withdrawal symptoms, and they can be there to help. Some of these severe withdrawal symptoms can be convulsions, seizures, heart conditions, and a lot of the withdrawal symptoms actually mirror severe anxiety symptoms. So that makes it even more difficult for the person to withdraw from BZDs because they feel like they need them even more when experiencing anxiety-like symptoms. With benzodiazepines, the withdrawal symptoms don't necessarily follow a nice even pattern of getting less and less. They typically fluctuate within the first year of abstinence. So things can be going well and smoothly, and then the person may get hit with withdrawal symptoms and feel like they're back at square one. Some initial substitution medication may help with these withdrawal symptoms, like flumazenil, methadone, carbamazepine, pregabalin are just a few, and these help with the GABA receptors, which is the calming receptor, helps calm people down. And here's just a quick list of all the possible side effects and withdrawal symptoms. As you can see, it affects nearly every part of the body and the mind. So again, it's very crucial to monitor the individual while they're going through that initial withdrawal. Some treatment as a therapist you can do has been shown to be effective or most effective with that 10-week taper. So just the 10-week taper without psychotherapy has been shown to be less effective than a 10-week taper with psychotherapy. Some evidenced therapy that works for both benzodiazepine addiction and, like I said, the anxiety it's used to treat is exposure therapy. This is often used with panic disorder, phobias, progressive relaxation, tensing the muscles, untensing them, doing the body scans. EMDR, eye movement desensitization therapy. This is often used for traumatic instances or PTSD. And it's important to remember that often BZDs are misprescribed to people with trauma because BZDs can actually enhance the traumatic response as opposed to actually calming it. So if a person has trauma in the past and they start abusing BZDs, their trauma symptoms may go up and they might not understand why. So that's important to remember. Cognitive behavioral therapy is often the therapy of choice, along with providing psychoeducation to the family and to the individual. The family needs to know what the withdrawal symptoms are like, so they can be there to support the individual. Also, having lock boxes in their medication, when to contact the doctor, how to support the person if they're feeling high anxiety symptoms. All this can be involved with the family or religious support system. Again, as I said, inpatient treatment initially is probably a good option. Also, maintaining sobriety, attending Narcotics Anonymous meetings and having a peer support and a sponsor has been shown to be effective in maintaining sobriety. And lastly, as I mentioned, lock boxes with the family, just to take away that potential harm or potential of overdose or suicide attempts if they're feeling very depressed or have a high anxiety level. Coordinate with the physician, as benzodiazepines can have a lot of physical effects and biological effects. Coordinating with the family physician for treatment is best practice. Continue to monitor the side effects. And again, help the person develop coping techniques so they don't feel they have to automatically go to the BZD when they start to feel high risen level of anxiety. Moderate or just completely eliminate alcohol or marijuana or cigarette use, because this can be used as another negative substitute substance for what the benzodiazepine was using. And people who didn't or continued to smoke or use alcohol, even at a moderate level in their sobriety, were shown to relapse more often. Again, the goal of substitution therapy is typically abstinence, and it's developed through effective therapy and a support system. And some just alternate treatments that I can give. SSRIs, or serotonergic agents. Often they're used with depression, but can be shown to be effective with people who were addicted to benzodiazepines and are still experiencing symptoms of what they originally started taking benzodiazepines for. Acupuncture, massage, aromatherapy, just some natural relaxation techniques have been shown to be helpful, especially if you're talking about general anxiety, social anxiety. Exercise boosts some of those GABA receptors communication levels to help calm a person, the same as a BZD does, but natural. Again, that's the same with diet considerations. Some diets will elevate levels of neurotransmitter communication that you want. And so just looking into that with a dietitian, with a physician, with a therapist. Mindfulness meditation, Eastern practice, like I said, that kind of goes with progressive relaxation. And just if they do have faith, continued spiritual growth, and the support from their church body as they go through withdrawal and maintained abstinence, has shown to be effective.
We've been talking a lot about the effects and treatment of those individuals that are addicted to benzos. And so now we're going to look at what the effect has on the individual's family, as well as just their own personal social development. And as with any addiction, there are many concerns that arise with those addicted to benzos, and how their addiction takes a role in their personal lives as well as their families. What benzos does for the individual, that's why it's so addictive and why it's so attractive to folks, is it allows people to sort of check out, much like alcohol. People who abuse benzos are like those that abuse alcohol, where they take the drug for the purposes of just checking out and not being around and having a sense of euphoria, and just sort of de-engaging from the people around them. So in that checking out, that addiction becomes a part of their life, and they begin to abandon their responsibility to their family, their work, and their personal life. And that abandonment ultimately creates a lot of problems within the family, because that withdrawal causes them to withdraw from their work responsibilities to the point where those addictive behaviors can create indescribable social harm as they withdraw from their work and not having the same productivity as they usually have from work, which ultimately can lead to a lack of trust from the employer or their job that can lead to either suspension or potentially even losing their job altogether, thus causing financial strain upon the family because they no longer have a source of that income. And so that loss of family or loss of income for the family can have financial tolls and also have social tolls with that person as they're not able to connect with people around them, their coworkers. That might be an emotional support for them, or just friends in general as they just regress and withdraw from people individually. With that potential financial loss, the family can incur a lot of different issues in the family financially due to the addict spending family money on their own habits, but also family money on potential treatments. That money could be going to other things such as kids baseball or college or things like that. But that money is diverted potentially to the addict's treatment, and that affects the family long term. Also, recovery may be expensive, and so there may be taking on of debt that can cause financial burden to the family as well, either for treatment purposes or the fact that the addict spends the actual cash to buy their drugs, and so thus they have to take on debt for other reasons to pay the bills on a monthly basis and so forth to sort of keep the lights on. And so just that toll of financial toll has a big effect on the family altogether, and that's why this is such a bad thing. Also, for those that just are taking care of people that are on benzos or addicted to drugs in general, they can experience a loss as well, a loss of time, energy, finances, the psychological well-being. There's just a great toll on the family altogether as they support somebody who's addicted to benzos. From a spiritual perspective, benzos create a desire for escapism, which we talked about a little bit earlier. And in that escapism, that addictive nature of the drug creates an amplified effect of escapism, meaning that as they become addicted, the more they want to escape from reality, the more they just want to retreat and withdraw. And the reason that's such a bad thing is that escapism over time and that addiction over time becomes an idol for that addict. A study was done, and they found that they asked those that were sort of had this addiction, and they talked about their spiritual life, and many of them said many things, but some of the things that they said was that their addiction caused them to put God on the back burner, or they began to put their faith in the drug instead of God. And that level of thinking, that way of replacing God with a drug or with benzos, is just inconsistent with the Christian life. And actually most religions is because you're creating some idolatry where you are essentially replacing God for something else. And this is destructive because our ultimate desire, what gives us meaning, what gives us a direction in our life is the things of God and what we yearn for God and how we yearn for God. And that gives us meaning and that gives us direction. And when we replace that with things that ultimately don't give us meaning and don't give us direction, that begin to steal those things away, we ultimately have a life that is not full, right? Christ said that he came to give us life and give it to the fullest. And this addiction to benzos, this withdrawing, takes away our meaning, it takes away our direction, and ultimately steals our life. And that's what the real impact of addiction to benzos does to someone. Yes, there's a lot of physical issues. Yes, there's a lot of family issues. But from a spiritual issue, it essentially slowly steals our life because it gives us a lack of meaning and direction in life. Below, you have our references that you're welcome to look at. We have a couple of pages of references that we'd love for you to peruse. And if you have any questions or comments, we'd love to hear them via the Student Lounge. And thanks for spending time with us.